You know, everyone wants a beautiful smile, but sometimes it's not so pretty when you have those stained teeth. There's lots of products out there to whiten your pearly whites. What's the best option for you? Joining us now is Dr. Richard Yeager from My Dentist in Charlotte. Thank you so much. Appreciate you being here. Let's start off with what is actually causing the problem that you got to fix, the discoloration in teeth. What causes that, doctor?
Well, it's all the things you put in your mouth. The food, the smoking, the tea, the coffee, the Coke, all that stuff builds a pedicle on top of your teeth and stains your teeth. And over time, that pedicle and that staining gets into the enamel of the tooth. And the enamel is kind of like is made up of rods. And there's areas between the rods where that stain impregnates the teeth. That's why when you look at your teeth are a little lighter than your parents' teeth. And your teeth are darker than your kids' teeth. Over time, that pedicle and stain builds up on your teeth. And the only way to get rid of that is to whiten them or bleach them.
Well, I see all these commercials for the toothpaste, the whitening and the toothpaste and stuff. How well does that work?
The toothpaste, the whitening toothpaste, we have a couple of samples of them here. They are great at removing the surface layer of stain on your teeth, kind of like a scouring pad would take a stain off your pot or pan at home. Okay. Strictly wearing away the top layer of the stain. Okay. So going from those, how do the teeth whitening, how does that all work? Well, it isn't teeth whitening, it's actually bleaching. Bleaching is the next level, okay? Whitening is only getting over off the surface layer. Bleaching actually gets into the tooth and whitens the tooth. That stain over time, like I said, gets in between the rods of your enamel and builds up there. The bleaching agents get in there and oxidize that food out of there, and the teeth become white again. And they really become white about the level of the teeth or when they came in when you were 5, 6, 10 years old. You know, I've heard about this Zoom bleaching. Can you tell us a little bit about what it is, how it works, what it does? Sure. A lot of the bleaching things take anywhere from 3 to 6 weeks to actually whiten your teeth. Zoom bleaching is like it says, Zoom. You come into a dental office, and within 2 to 2 hours, you walk home with whiter teeth. I understand we have some photos we can show, like a before and after of what happens after Zoom. We get the before picture up here before we... Yeah. Oh, they're together. Wow. That makes quite a difference. And I'm telling you, this time of year, especially with all the events coming up, the weddings, you know, people just got done with graduations. It's great to have. You know, whiter teeth, that's the #1 question we get when people come into our office. How can I make my teeth whiter? How can I make them look younger? How can I make them look healthier? And the easiest way to do that is through whitening your teeth or bleaching your teeth. Is it painful? The procedure itself is not painful. Some folks experience some temperature sensitivity afterwards, which is strictly transient. It goes away, and we have, in the dental office, we have special material we can give you to minimize that. How about as far as the teeth when you're bleaching them? Does it make them weaker, or no, it doesn't affect them at all? Like I was telling you before, all it removes is the surface stain and the intrinsic stain, organic stain on the surface of the teeth. Okay, so I head into your office, I get the Zoom procedure done, my teeth are bleached, and I'm looking good, I'm out there, I'm smiling a lot, because you'll be smiling a lot more when you get the teeth done. Absolutely. How long is it going to last for me? You know, how long it lasts really depends on the stuff you eat, how much coffee you drink, how much tea you drink, how much red wine you drink, what the foods are. It can last a long time, but usually you have to touch it up from time to time. Just like if you wear the same shirt over and over again, the shirt eventually gets worn out. Got to rewash it and got to clean it up again. Maybe put some bleach on to get it white again. It sounds like a terrific thing to have done. Oh, it is. Everybody's always noticing your teeth, I'll tell you. Thank you so much. We appreciate you being here, Dr. Rob, thanks for having me. I really appreciate that. Glad to have you here.
How healthy are your teeth? It's important because it affects your overall health. That's why you should get regular dental checkups and screen for gum disease. Dr. Tom Pinnavaia from My Dentists joins us now. Dr. Pinnavaia, I'm glad you're here.
Pleasure to be here. Thank you.
We're talking about gum disease, and we're sort of debunking some myths, too, about it. First of all, tell us what exactly is gum disease and why should we be so concerned? Well, actually, Colleen, gum disease is the most common disease in the world. It affects as many as 9 out of 10 of us at some point. And it is a bacterial infection that affects the tissues that support the teeth.
So actually gums do not attach to the teeth as firmly as you might imagine. There naturally exists a shallow V-shaped gap or pocket between the gums and the teeth, and it's in this pocket that the infection occurs. Now, if the infection is really affecting only the gums, then we call it gingivitis, and most of us have heard about that. In more advanced cases, it affects the deeper supporting structures, the bone around the tooth, and then we refer to it as periodontitis.
And then it can cause a host of other problems, and that's why it's so important.
Absolutely.
Right? Okay, let's debunk some of the myths. The first one, gum disease does not affect overall health.
Well, actually, it very much does. And while gum disease doesn't sound particularly serious, research findings are now supporting what dentists have long suspected, and that is that infections in your mouth can really play havoc elsewhere in your body. They agree there's, really chronic inflammatory conditions, if you have gum disease, can really play off of each other. Things such as Alzheimer's, diabetes, heart disease, and even strokes are all affected and increased if you have gum disease.
Well, that ought to get you to floss,
That
really,
will.
And go to the dentist every 6 months. It does me. This I'm told is a myth, that gum disease is easy to identify.
Well, actually, millions of people have gum disease and don't really realize it. Often the progression of gum disease is very slow and actually quite painless. So you should always get involved with your dental care. We're constantly asking our patients if they've had any of the signs of gum disease, if they've had any changes in their overall health, or any medications they've been taking, and so this sort of team approach helps us to identify subtle changes that can occur over time.
Okay. Is it normal for your gums to bleed? I know some people think that when they floss, and that can happen sometimes. Is that a normal thing?
Well, no, it's not. Actually, bleeding gums are one of the most common signs that you have gum disease. And Colleen, if you think about it, if your hands bled every time you washed them, you'd certainly know something was wrong. And this is the same as if your gums bleed while you're brushing your teeth or flossing your teeth. So it's very important to be aware of those things. And some of the other warning signs of gum disease are red or swollen or tender gums, gums that are pulling away from your teeth, bad breath, that's a big one. Loose or separating teeth, or a change in how your teeth fit together.
Okay. This, I'm told, another myth, treatment for gum disease is painful?
Well, very few people are ever really excited about going to the dentist.
No offense, of
No,
course.
my own father included. Sorry, Dad. But, these treatments, usually are very much non-surgical. And, these treatments in conjunction with some local anesthetics and over-the-counter medications really make most patients' experiences quite pleasant and comfortable. In fact, the vast majority of our patients, go back to their normal routine or go back to work the same day right after treatment.
Oh, that's great. That's
Absolutely.
good to know. See, don't be afraid. They really do try to make it easy for you. Pregnant women, should they get their dental checkups? Yes, no?
Absolutely. No, this is an important one because, certainly hormonal changes increase the sensitivity of gums during pregnancy, and studies are really showing now a relationship between gum disease and preterm low birth weight babies. So women with gum disease may be as much as 7 times more likely to have a baby that is born either too soon or too small. So any infection, especially gum disease, is cause for concern in pregnancy. So that's why we strongly encourage women who are pregnant and who are trying to become pregnant to have a thorough dental checkup.
Okay, and the last myth today, Dr. P. Do you mind if I call you Dr. P?
Absolutely, that's fine.
I'm going to screw up your last name again. Tooth loss is a natural part of aging?
No, it absolutely is not. In fact, with routine dental care and good oral hygiene, our goal is to have your teeth last a lifetime. So we always recommend you brush and floss after meals and before bed, and of course, come see your dentist at least twice a year.
Go see the dentist. Go see the dentist. Dr. Pinnavaia from My Dentist, thank you so much. We appreciate your time today.
Pleasure being here.
Everybody floss today.
Most adults aren't crazy about the idea of wearing braces, but the doctors at My Dentist showed Davey Sutton an option that won't leave you being called metal mouth.
Growing up, I always wanted them because I've always had a bit of a space between my teeth.
Frank came in and he's very typical, a typical smile where a person had a space between their front teeth for years. He's always kind of been self-conscious about it.
My hesitation was how are they going to look on a day-to-day basis? Go to meetings, make presentations.
Frank Dukes is a finance manager at Bank of America, which means traditional braces just wouldn't work.
And he didn't really want that. He has a job where he's up in front of people all the time and talking. When he came in here, we talked to him about maybe doing some Invisalign, where he was able to just close the spaces and make them look more natural.
Frank saw perfect results in just 6 months. Paige Hamilton had a different issue.
Well, it was last year in the fall when at the end of each day I just felt like I needed to be doing something because my bite was changing. So in biting down, I knew something was wrong.
All the front teeth have started kind of overlapping and turning somewhat. She's one of the people who oftentimes would kind of cover their face or something like that when they were smiling because she wasn't real happy with it. Hey, I'm so glad you could make it in here today.
And so I decided to come in, and all the doctors here stated that, Paige, the longer that you wait, the older that you get, the difference is going to be even worse.
Kind of tilt your head back just a little bit there. We talked to her about the opportunities that Invisalign would give her, and she was really excited about doing it.
Paige's teeth needed to be spaced out, and Frank's had to be squeezed. Invisalign was able to help them both out.
Somebody that's a candidate for Invisalign has to be able to wear these aligners for periods of time during the day, because it's essentially it replaces having to have brackets and wires in your mouth. The procedure is actually fairly straightforward. We take some models and take some impressions, and we actually take some photographs and some x-rays of the person's mouth.
From the model, the dentist will mold a series of aligners that will move the teeth.
You change an aligner about every 2 weeks, and over a series of 20 weeks, you come in about every 2 to 3 weeks for us to check them and make sure the teeth are moving like we want to.
The Invisalign aligners are convenient for patients to remove while eating and safe to keep in while drinking clear liquids.
We want you to wear them again like 20 to 24 hours a day, but in that instance where you want to take them out and have to take them out, that isn't always an option.
They're very comfortable. I don't even feel like they're in. I've never had a problem speaking. I've really enjoyed having them, and I only have them for a year, so this December they're coming off.
As for Frank,
some folks who haven't seen me in quite some time, say, wow, there's something different about you. I've had folks to say, your teeth look great.
I have a great opportunity for you. My dentist will hold an Invisalign Day in September. You will get a free consultation, and if you commit to start treatment for Invisalign, you will get $1,000 in free stuff, including a $250 Visa gift card you can use for anything you want, free teeth whitening, and much, much more.
That's cool. Can anybody go to this?
Yes, but you have to RSVP ASAP because there's limited space, and you don't want to miss out on it. Even if you were considering braces, sign up. And to sign up, go to My Dentist, and it's 704-375-8577.
That is fantastic. You can't even notice them at all. It's a mouth guard. It's a mouth guard on steroids is what it is. Thank you, Davey. Appreciate it.